Bonjour. So thank you very much for being with us here today, and I would like to especially thank the representation from the Ministry of Higher Education and Scientific Research of Côte d'Ivoire, and the President of Giraffe, and also his support to make this event and this meeting happen. Of course, the Vice President of Giraffe, also the past presidents of Giraffe, and the General Secretary of Giraffe, which is the Association of Inter-African Fertility Research and Application Study Group for Francophone African countries. Of course, I would like also to thank and welcome the presidents of Fertility Societies of Côte d'Ivoire, Cameroon, Togo, Benin, Senegal, Burkina Faso and Mali. Please, I would like to thank you all and welcome you to our first Merck Foundation Cote d'Ivoire Alumni Summit in 2024, and this is going to be our first. But if you remember, we were here in 2016, 8 years ago, to conduct our third edition of Merck Foundation Africa Asia Luminary, which is our annual conference, and it was very successful. But as we heard when we were in 2016 here, you would like Merck Foundation to focus, as much as we focus on English-speaking countries, African-speaking countries, we would want us to focus also in French-speaking countries. And this actually, thank you. And this actually was also a direct instruction from Professor Frank Stengerberg-Haverkamp, the chairman of Merck Foundation Board of Trustees. He wanted us to focus on French-speaking countries and also Portuguese-speaking countries. And of course, this was considered very highly. And if you see the numbers now, you will understand that as much as we could, and as much as we find local serious partners in each country, we actually give our all to make it as equal and to improve equal access to quality healthcare solution in all Francophone, 14 Francophone African countries that we are actually working closely with our partners in these countries. So, if I give you that, of course, Merck Foundation, as you know, focus on building healthcare capacity and providing scholarships of 1-year diploma, 2-year master degree, and clinical training in many specialties, up to 42 specialties. As you know, it's always very difficult to find the training and the education and the diplomas in French, but we had made sure that even if we have clinical training in, for example, in India, in many specialties that we're gonna start with you today, we have interpreter with each doctor or scholar, so we can improve his adoption of the information and the training excellence that he can has. So let us talk about that. Merck Foundation actually is very funny, because Merck Foundation, until yesterday, we were writing in our speeches and our reports that we provided 1,760 scholarships for doctors from 52 countries, including African countries majority, and in 42 critical and underserved specialties. But yesterday we updated these numbers. It's not even updated in our speeches yet. 2,810 scholarships. So increased by a good number, because the programs was running and we already enrolled new doctors into the programs. But out of this, we have 350 scholarships provided for Francophone African countries in many specialties, especially focusing on cancer and fertility specialty, embryology, diabetes management, hypertension and cardiovascular preventive, and acute medicine and ICU training. So this is also very important, mainly clinical training, as we know. And out of these 350, which is its specialties, 100 was in partnership with Giraffe. 100 scholarships was provided for doctors from 14 Francophone African countries in the following: fertility specialty and embryology specialty. In fact, In many countries like Niger, Chad, and Central African Republic and Burundi, we provided the training for the first fertility specialists and first embryologists in these countries. So it was really a significant achievement and a very important and outstanding milestone, because together with our partners in this country, we provided the first fertility training for the first fertility specialists and embryologists, the first fertility care team in those countries, which is very important. Before that, it was couples who suffer the delay of having baby or childless or infertility. They were suffering the stigma in silence. There is no place to go because most of them didn't have the financial resources to take them abroad for treatment, even if it is for small intervention. We resolved that with our partners. As you see, this was all part of Merck Foundation More Than a Mother campaign. Our signature campaign, like in the video you have watched, which is very close to my heart. As an African woman, as an CEO of Merck Foundation, very close to my heart, because together with our partners and ambassadors, like the 24 First Ladies, we working together for the past 7 years as ambassadors of More Than a Mother. We improve access of these infertile women and childless women to better information, education, health, and sometimes also economic empowerment, like we did with Jacqueline. So before that, women who suffer infertility, they suffer the stigma of infertility, the discrimination and ostracism, and sometimes the violence physically or psychologically, and sometimes divorce. And this all was based on the misunderstanding and the lack of awareness about the infertility is not a stigma, it's not a taboo, but it's a condition, can be prevented and can be treated. So if I tell you in Africa, as per WHO 2012, it was 1 every 4 couples are infertile couples. It's a huge percentage, but also around 85 of these infertility cases can be prevented because it's due to untreated infectious diseases that are caused by child marriage, FGM, unsafe abortion, unsafe delivery, and STDs, and many other things that if we can detect it early and treat it early will not cause infertility. It means that 85% of the infertility cases that existing today can actually be prevented and never exist. So, of course, our campaign was relevant to that because raising awareness, community awareness in different ways to about prevention, infertility prevention, and male infertility also, awareness about it, and breaking the stigma of infertility through all the sectors, in collaboration with Ministry of Education, Ministry of Communication, Ministry of Health, Fertility Societies, medical societies, and also media and artists and songs and animation movies and all this that can actually create a culture shift. Culture shift say no to infertility stigma. If I go through in all our scholarships across Merck Foundation, we have 560 scholarships provided only for fertility and embryology and also sexual and reproductive care. This is a huge number out of the total scholarships we are providing. This tells you that we are taking this campaign as a signature campaign and it's very important for us. But we are not only focusing on fertility, and we want in Francophone African country also focus on other specialties, and we are asking you to apply for more scholarships in more specialties like diabetes, like hypertension, cardiovascular preventive, and oncology, and also acute care and ICU. Therefore, we are really welcoming the partnership with our new partners, the presidents of different societies, like cardiovascular societies. I welcome them as well with us, like the gynecology and obstetrics societies presidents, and the president of rheumatology and immunology society, and president of diabetes society of Côte d'Ivoire. So welcome to our platform, and we would like to work closely with you so we can have more and more scholars in different specialties in our Francophone African countries, and of course starting with Côte d'Ivoire since we are here. So I would like also to invite you to watch our first animation movie we have done in 3 languages about More Than a Mother, whereas we're talking about the infertility and infertility stigma and how men can also be infertile. It's 50-50, so it's very important as well. But also we developed animation movie about diabetes and hypertension, which we are going to watch together in French today. But of course we have it in English and in Portuguese as well. So I would like also to draw your attention that after this meeting we will have the first health media training of Merck Foundation, where we are going to provide training, health media training to media representative, our media partners, who will be also our alumni after they win the awards that we are going to also announce, which is the Media Recognition Award and Song and Film and also Fashion Award. And the details of this awards, you will find it on our website, but it's all about 2 categories, either More Than a Mother, of course you know, it will be about breaking the stigma of fertility, or either Living Healthy Lifestyle, where we are going to raise awareness about diabetes and hypertension and promoting healthy lifestyle. So, and this media training will be about these topics as well, in addition to girls' education. And I don't want to miss girls' education since we have the presentation of the Ministry of Education here. We are providing scholarships for girls who is underprivileged and underprivileged but very highly performing to continue their education in school, so they don't miss this opportunity and excel, reach their potential and fulfill their dreams. And we will be talking about this with the Ministry of Education to select these 20 girls that we are going to provide the scholarship for, to join the other scholarships we are providing with our first ladies of the 24 countries that we've mentioned. Thank you very much. I don't want to stay here for long because there is too many things we can talk about. So, but of course, there are many things that Professor Frank Stangenberg, the founder of Merck Foundation, the chairman of Merck Foundation Board of Trustee, will inform you about. Very important, so please pay attention to all the numbers and all the things that he's going to tell you. Thank you very much.